Now, moving on to our next scheduled activity. This is going to be another interactive activity. And we're lucky to have Dr. Elia Khalaf here, who's a registered creative arts psychotherapist that works at Sylvester Cancer Center. And she's going to talk to us and maybe demonstrate a little bit about art therapy and how it can be healing. Thank you, Dr. Khalaf.
All right. Hello, everybody. I'm super excited to be here, and thank you, Dr. Jose, for the introduction. I'm not a doctor yet, hopefully in the future, but I am an art therapist, and I'm so excited to be presenting today. I will talk a little bit about art therapy, and we'll also have sort of an integrative activity to try something together in Experiential. And a big thank you to AIM for organizing this and for everybody with my team at Sylvester. So I'm going to go ahead and start sharing my presentation now. And I'm going to start just diving into sort of an experiential, and then we can talk a bit more about the theoretical framework and sort of the information aspect. So let's start with this image, just taking a moment to let your mind sort of anchor in this moment. Looking at this visual that's in front of you. And I'd like you to start with just naming mentally a few key words without judgment based on what you see. So you might notice the colors, you might notice meaning, or you might make meaning of the image. And next, I would like you to try and really put yourself inside this space, inside this image, and consider all of the senses. We talked about what you see. Maybe consider what sounds you might hear if you were in this painting. What scent or smell you might pick up on. Or maybe just the quality of the air if you feel like this painting is associated with cool air or warm salt water. Whatever comes to your mind is okay. And consider the textures. If there's something you would touch, is it water? Is it sand? Is it maybe leaves or something in nature? The texture that your body can also activate. And so this has been sort of a brief 1-minute experiential of how we can engage with an artwork. And I think it's a good point in terms of when we look at art therapy, when we look at images in art therapy, it is beyond the aesthetic and visual aspect. And it is more about an integrative experience that connects the body to a sense of calm and to a sense of relaxation. One of the main goals in art therapy is stress reduction. And so to give you a bit of information and facts, the definition of art therapy is that it's an integrative mental health service. So it supports mental health and well-being. It's integrative in the sense that there's active art making and creative process, but it is also really rooted in applied psychological theory. And it happens within a psychotherapeutic relationship between the art therapist and the client. And who are art therapists? As Dr. Poza and my colleagues have been talking about today, it's really important to kind of identify who you're working with to make sure that you're well supported. So art therapists are master level clinicians. They're licensed and certified, and this one depends on state. In Florida, licensed as mental health counselor and registered and board certified as an art therapist on a national level. To become an art therapist, there's 1,000 hours supervised practicum within the master's and 1,000 hours of postgraduate supervision and contact hours as well in order to get that licensure and to become an art therapist. And a little bit about the theoretical framework. And I like to really rely on the neuroscience too as one of sort of the theories behind art therapy. And we know that whenever people are making art, there's an increase in blood flow to the prefrontal cortex. And that's the area of the brain that's associated with regulating or organizing thoughts and feelings and action. And it's also the area associated with a sense of reward or achievement, which makes sense because when we make art, we might feel like we accomplished something or we completed a project. Also, we know that whenever there's art making, there's a boost in the level of dopamine, which is the feel-good neurotransmitter and might help uplift mood. And also there's a decrease in the level of cortisol, which is associated with stress and anxiety. So there's the stress reduction piece. And a lot of people, when they hear art therapy, they also kind of think of an art class because that's what we might be more familiar with. So I think it's important to make a distinction. We do share art supplies and creativity, that is in common, but an art class is more about learning specific skills. It's more about the aesthetic. It's more about the visual aspect, so making a finished product, and it's usually helped or taught by an instructor. However, what we do in art therapy, you don't have to have any skills or previous experience required to benefit and participate. The focus is a lot more on the process itself and the journey rather than the product. So what we might make could be messy or might not be necessarily aesthetically pleasing in sort of the conventional sense, but it's more about how we make it and how we feel in that process and what we learn about ourselves. And it's usually supported by the art therapist or a counselor. And to give you some example of things we do in art therapy, there might be an open studio approach, which works really well in a group setting, virtually as well. That's one thing that we've been doing at Sylvester. Part of our support services online is online art therapy groups. So people can come in and they can work on their own projects. They can work on a collage, they can make textile art, they can paint, sculpt. So that's really diverse in the sense that there isn't a cookie cutter answer of what art therapy can look like. It really depends on people's preferences. And what I'm gonna be using today or relying on today is poetry and creative writing as an activity. And there's also a level of assessment. So as we make art, we might gain insight into our own thoughts and our own feelings. And that could be happening whether it's through drawing a self-portrait, drawing a family portrait, drawing yourself in a group, or also using mindfulness techniques and relaxation techniques as well that are meditative. Some specific benefits for art therapy in oncology. A lot of times patients in treatments or also survivors might not find exactly the right words verbally to express their feelings. And this is where art can be really powerful in the sense that, you know, we all know the saying, a painting or an image can speak 1,000 words, and it goes beyond verbal communication. So it can really help self-expression. There's a sense of kinesthetic and sensory experience. So we're engaging our body, like when we started with the painting, imagining the textures, imagining the scent in a safe way and a positive stimuli. It helps with coping with anxiety, reducing stress. And a lot of times people start working during treatment, start working with art therapy and might identify as a patient in the medical setting, but through the process of art therapy, they can develop different aspects of their identity. They might identify as an artist, as a sculptor, as a poet. And lastly, in art therapy, one of my favorite parts is that there's a lot of freedom, there's a lot of active decision making. So people can choose what colors they're using, what materials they're using. And in a space where sometimes we don't make all of decisions that are related to our treatment, this is a space that's open where you can make all of the decisions that relate to what you're making and what you're expressing. So again, it can be very freeing and it can help reduce stress. And I'm gonna, excuse me, switch gears into creative mode again. I'm gonna show you a few images specifically that relate to spaces in different rooms. And I'd like you to just observe the images and kind of identify one or two that represent your current headspace, things that relate to how you feel today or how your your thoughts are looking like in your mind. So take a moment to just observe what you notice in the image, relying on the colors and the textures. And maybe the facial expression of the person or the character in this image. This is another one and it's a different space. You might feel differently looking at it. There also might represent how you feel. And as you can see, the images may be very symbolic and might look different, might be photography, might be painting, but try to relate it to your thoughts and your feelings today. And this is more of an open space, so you might feel differently looking at it. You might feel like you might want to be in this image more than others. Or not, there's no wrong answer. It's all about self-expression. It's all about finding different tools. And this is similarly a poem that relates to space. It's one of my favorite poems, and it will sort of help us lead into the integrative, the hands-on activity that we're about to do. It's by Robert Duncan. And I've highlighted some of my favorite parts. You might have other parts in this poem that you like. Feel free to screenshot this or save the title for later. But it says, as if it were a scene made up by the mind that is not mine, but is a made place that is mine. It is so near to the heart, an eternal pasture folded in all thought, so that there is a hall therein, that is a made place created by light, where from the shadows there are forms fall. And the poem continues to say, often I am permitted to return to a meadow as if it were a given property of the mind, that certain bounds hold against chaos. I like this poem as it relates to art therapy because in this practice of art therapy, we can create a space in our mind and a space for ourselves to practice all of the things we've been talking about, to practice self-expression, care, and healing. So we have a few more minutes, and what I would like you to do is, with whatever is accessible to you, you might have a pen and a notepad in front of you, or maybe just using an app on your phone, it's totally okay too, to consider writing about a space, a room that you'd like to be in. So again, this could be in any way. You can write it as a comment on Facebook, you can write it on your phone, or you can write it down handwritten on a pad or a paper in front of you. But consider where the space would be. If it's part of a structure, if it's a room, what is it inside of? Try to be really detailed. If it's a bedroom, what kind of bed it is. If it's a kitchen, if it's a balcony, what is it made out of? What are the things that are around? What kind of light is inside this space? What furniture do you have? What are some shapes that you see? Some textures? There are windows, how many? Really delving into the details and kind of furnishing the space in your mind, focusing on all the things that help you relax, all the ways that you can find calm and peace in this space. If there's a window, what do you see outside when you look out the window? Again, checking into the body in this safe and calm space, noticing what sounds you might hear. Maybe there's music, maybe there's gentle sounds from nature outside, wind in the trees or animals. Really imagining the room as deeply and as thoroughly as you can. And give yourself a couple of minutes to do this. You don't have to complete this exercise now, but it is a prompt to give you an idea of something to start with and something to return to in moments of stress. Oftentimes we use writing in tandem with visual arts, with painting. So in a sense, you might rely on one of the images that we saw today that you kind of related to or that resonated with you. And maybe that's one of the artworks that you want to describe for your own safe space. If you can't think of or remember a specific space that you're familiar with, you can always create your own as well. So this is kind of an open-ended question. And if you feel like sharing what you wrote, or if you have any other questions, please feel free to reach out to me. I will show you my email address in a second. And you are always welcome to attend one of our art therapy studio groups online, which happen Mondays at 2 p.m. Eastern time, Miami time. And there's also other very awesome, great arts and medicine groups. There's virtual museum tours and walks in nature, as well all the other services that my colleagues provide. So definitely keep an eye on the Sylvester Support Services calendar for online services. And I think this is a good point to wrap up. This is my email. Feel free to save it and reach out if you have any further questions. And I will stop sharing my screen now.
Thank you. Thank you very much, Dr. Khalaf, for this very inspiring talk and demonstration. Again, we will be answering any questions towards the end of our meeting today.